Now, talking about treatment of the varicose vein, the principle of treatment, number one, we need to identify where is the source of the high pressure which cause dilatation, bulging of the varicose vein, and we need to stop that part of the high pressure point, or some people would say leaking point. And what we can do by ultrasound, the ultrasound we can identify where is the leakage point, or in other words, ultrasound will get into the bottom of the problem. Now the treatment is normally it's combination of, number one, try to stop the part of the leakage of the high pressure point, which we can do by many ways, but in my hand and according to the guideline around the world from American, European, Australia, UK, is the laser or what we call thermal treatment. Laser is the way which the tip of the catheter increase the temperature 200 or 300 Celsius. So imagine in the boiling water 100 Celsius, it can cook the meat. The same thing happens when the laser, the tip of the laser, the temperature increase to 200 or 300 Celsius, because it cooks the vein. When we compare the treatment with the old way is the surgery. The open surgery is the patient needs to be sleep or general anesthesia, and the patient need to have a cut here and another cut in above the knee and remove the vein, what we call venous stripping. That treatment is quite aggressive or invasive treatment. Number one, patient need to have sleep, but whereas the laser, we can treat by only numb the skin and put the catheter and open the laser and pull the laser out. Number two, the patient can move themselves immediately after treatment by laser, or in other words, by the laser treatment it can be walk-in walk-out treatment, and of course the bleeding is much less by the laser. So I think this is why the laser is the standard treatment nowadays. So that is number one treatment, to stop the leakage point. Number two, in the brain which is mounting in the skin, we need to treat by other means. Number one, we can treat by what we call sclerotherapy. It can be used by the under the ultrasound guide and put the sclerotherapy. What is the sclerotherapy? Sclerotherapy is we inject the sclerosing detergent to the vein, and then it will cause the inflammation of the inner layer of the vein, and it will shut down the vein in future. Number two, we can remove the bulging vein in the leg, what we call the modified ambulatory phlebotomy, or easy word is phlebotomy. What we can do is we cut the skin around 2 or 3 mil, and then we hook the vein, and then from the area of the varicose vein, that is the vein which we can remove. And this technique, it's quite good to remove the varicose vein immediately, but it can bleeding after treatment. And so at the moment we usually do what we call modified phlebotomy. What we can do is I will inject the sclerotherapy first, and then I do what we call phlebotomy, small cutting and 2 or 3 mils, and then remove the vein from the skin.